Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about schizophrenia. We'll first look at what schizophrenia is. We'll then look at the risk factors, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Schizophrenia is a chronic mental health condition characterized by an interference in a person's ability to think, feel, and behave. People with this disorder experience distortions of reality. The average age of onset for schizophrenia in men is between the ages of 15 and 25, while for women it is between the ages of 25 and 35. Schizophrenia affects approximately 1% of people in Canada, while it affects 22.1 million people around the world. Risk factors. The risk factors for schizophrenia include genetics. People are 6 times more likely to develop schizophrenia if they have a close relative with the disorder. Problems with brain chemicals, such as dopamine and glutamate, which are neurotransmitters that allow the communication between brain cells. Exposure to viruses, toxins, or malnutrition before birth, specifically during the first and second trimesters. The use of mind-altering drugs during the teenage years and young adulthood. Symptoms. There are different kinds of symptoms of schizophrenia. Psychotic symptoms include changes in a person's thoughts, behaviors, and experiences, such as hallucinations, in which a person hears, sees, smells, tastes, and feels things that are not there. Delusions, in which a person has false beliefs despite contrary evidence. Thought disorder, in which a person has unusual or illogical thinking. Movement disorder, in which a person has abnormal body movements. Negative symptoms include loss of interest or excitement for life, a lack of emotions or expressions, social isolation, difficulty completing plans or activities, and difficulty completing daily activities. Cognitive symptoms include difficulty processing information to make decisions, difficulty learning information and using it, disorganized thinking, including difficulty focusing, forgetfulness, and disorganized speech. Effects. Schizophrenia can cause severe complications, including anxiety, depression, phobias, family issues, school or work issues, financial issues, homelessness, chronic health problems such as heart disease, alcohol or drug misuse, self-injury, and suicide. Treatment. A common type of treatment for schizophrenia is psychotherapy, including cognitive behavioral therapy, which can help a person understand and change their unhelpful thoughts, feelings, and behaviors. Family therapy educates family members about the disorder, as well as strategies to cope with the condition. Art therapy can promote creative, nonverbal ways to express oneself and help a person better relate to others. Electroconvulsive therapy is provided to people who sees no improvement with other treatments and are at risk for harming themselves and other people. This type of therapy uses an electric current on the scalp to cause a brief seizure, which helps to improve brain function. A doctor may also prescribe medication, such as typical antipsychotics and atypical antipsychotics. Coping strategies. To manage the daily demands of living with schizophrenia, a person can use the following coping methods. Manage stress to avoid worsening symptoms. Join a support group. Reach out to family or friends for support. Write in a journal when emotions become overwhelming. Eat healthy. Exercise regularly. Get adequate sleep. And avoid the use of alcohol and drugs. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.